very warm welcome to our webinar, jointly hosted by GenesisCare and Brohn UK. My name is Sally Sadiq and I work for Brohn as the partnership lead with GenesisCare. This session lasts for an hour and we will be recording it, so both organisations can use it to further help more people with cancer. We will be using a short polling questionnaire at the end of the session, as we're keen to know if the session has met your needs. Your answers will be anonymous. Today's session is part of a series of webinars on integrative cancer care, treating the whole person, which will cover various ways that cancer treatments like surgery, radiotherapy and chemotherapy can be combined with lifestyle and complementary approaches to help reduce side effects and to improve outcomes for people affected by cancer. Today's topic is breast cancer. Dr. Catherine Zollman will be posing questions to our panel guests. If you would like to ask any questions on this topic, please use the question and answer function. We won't be using the chat function today. I'll be keeping an eye on the questions coming in and raise them with the panel if time allows. We may not get a chance to answer all the questions in the limited time, so please bear with us. And please note that panelists will not be able to answer any questions that relate to an individual circumstance or case. All opinions are the panel's individual opinions and they are not representative of either organisation. If you'd like to know more information about both GenesisCare and Brohn, you can see the slide ahead of you, which I will now turn off and hand over to Catherine.
Well, good evening, everybody, and welcome to tonight's webinar. I'm really delighted to be joined by an expert panel tonight to discuss what is integrative cancer care and why do we need this particular expanded toolbox to help in the management of breast cancer. And I just want to say at this point that we'll probably use the terms integrative oncology, integrative cancer care, integrative approach to cancer interchangeably. To my mind, they all mean the same thing, so don't get hung up on which term we're using. And I do want to spend a little bit of time now just unpacking what do we mean when we talk about integrative cancer care. Well, the International Society of Integrative Oncology defines it as the intelligent, coordinated use of evidence-based lifestyle approaches. And by that, they mean things like physical activity, nutrition, stress management, psychological approaches, and complementary therapies. And we'd include in that things like acupuncture, massage, music therapy, herbal medicine, those sorts of things, alongside conventional cancer care. And the aim of using this integrative approach is to provide the best cancer outcomes with the best quality of life. And there are many different ways in which these additional tools can help deliver that outcome, the best cancer outcomes with the best quality of life. So sometimes they can help people deal with the impact of a cancer diagnosis. And by that, we might mean the physical impact, the psychological impact, or the emotional impact. Sometimes these other approaches can help reduce treatment side effects. Sometimes they can make conventional treatments more effective. And sometimes they can help build overall resilience, giving people more control over their situation. And sometimes they work alongside conventional treatments to reduce the chances of the cancer coming back or progressing. So there are many different aims that we might have when we use this combination of approaches. So how widespread is the use of integrative oncology? Well, there have been many surveys done over the last few years looking at this, and they show that between 40% and 90%, depending on how you exactly define complementary medicine and lifestyle medicine, 40 and 90% of people with cancer, and particularly women with breast cancer, use some form of complementary therapy or lifestyle approach in addition to their conventional treatment. And most of them do this without the knowledge or the involvement of their oncology teams. So that's quite a lot of people using these approaches and quite a lot of it going under the radar. So in 2017, the SIO, the Society of Integrative Oncology, produced a clinical guideline on both the benefits and the safety of using these integrative approaches. And they based that on a systematic review of all of the available research, which took into account the quality of the research and the quantity of the evidence. And they reviewed how appropriate it was to use these integrative approaches to help deal with a number of the different common situations and conditions that affect people with breast cancer, such as fatigue, low mood, anxiety, lymphedema, chemotherapy-induced nausea and sickness, peripheral neuropathy, which many of you may know is a condition that affects the nerves, and it's caused by some forms of cancer treatment, chemotherapy treatments, hot flushes, menopausal symptoms. They looked at a range of different things that are commonly experienced by people with breast cancer or going through treatment for breast cancer. And they put the evidence together. And in 2018, so the following year, the guideline was reviewed by an expert panel, not just from the Society of Integrative Oncology, but from ASCO, the American Society of Clinical Oncology, which is the leading professional body for oncology in the world. And the ASCO expert panel determined that the recommendations in the SIO guideline were clear, they said, they were thorough, and they were both based on the most relevant scientific evidence. So ASCO endorsed the guideline, and this endorsement was published with the main recommendations and a commentary from ASCO in the Journal of Clinical Oncology, which is one of the main journals that oncologists and oncology professionals use, and that was in 2018. Now, you'd have thought that that might be a game changer, but despite this, most people with breast cancer in the UK are not getting offered or signposted or even told about any of these evidence-based additional tools, even if they're presenting with symptoms which aren't currently being well controlled with conventional care and where integrative approaches have been shown in trials to have potential benefit. So why is this? Well, I guess many UK breast clinicians are just very, very busy people who are very focused on their own specialty, and they're not aware of these guidelines or of the research evidence because it comes outside their usual scope of practice and their usual scope of education. Most doctors and healthcare professionals are not taught about these approaches in their trainings, so they simply don't know about where you would go to find out about these things. Even though sometimes they're published in the mainstream journals, sometimes it just doesn't register because it's not the sort of thing that you're trained to think about or to be interested in. But even if they are aware and even if they are interested, there's very little statutory funding provided by the NHS to deliver integrative services. So in the few places where it is available, it's mostly provided by charities or by volunteers, and it's very haphazard and it's often very unsustainable. So it might pop up and then funding might run out and it might disappear again. And as we've said, most people who use some form of complementary medicine, and studies have shown it's generally more than 70%, don't tell their oncology team. So actually, there may be an awful lot of this going on, but we're just not aware of it. And I think many people would agree that the situation is not really very satisfactory, and it can lead at best, I guess, to a sort of sense of frustration and a reduction maybe of satisfaction in the relationship between patients and their healthcare professionals. And maybe at worst, it can lead to a genuine risk of harm or interference with beneficial treatment, and actually worse outcomes because people are trying their best, but in an uncoordinated and unintegrated way. So that's why tonight is such a special occasion, because GenesisCare is one of the UK's exceptions in terms of delivering integrative cancer care, truly integrative, where at the same site where the conventional treatment is delivered, there is also a provision of these more integrative approaches. And through its impressive exercise medicine programme and its unique partnership with Brohn UK, everyone receiving cancer treatment through GenesisCare centres is provided, unless they opt out, with a wellbeing consultation, which includes a holistic needs assessment. And they're offered a range of integrative approaches, including exercise medicine, acupuncture, reflexology, and counselling. And they're also signposted to a range of other integrative services like support with nutrition, relaxation practices, and mindfulness meditation. So we have convened tonight's expert panel from among the many talented staff who work with GenesisCare. And I'm delighted to be joined by Professor Amit Bal, a consultant oncologist from Bristol, Miss PG Roy, an oncoplastic breast surgeon from Oxford, and Tony Hennings, an acupuncturist and former therapy radiographer from Windsor. And they all have extensive experience of working with people going through treatment for breast cancer. So tonight we'll be looking at what benefits they feel this integrative approach offers in practice. We'll also be considering whether there are any problems or maybe what we'd call contraindications, situations where it wouldn't be a good idea to use integrative cancer care. And we'll also be looking at what specific approaches might be helpful for some of the common concerns of people with breast cancer. I mentioned quite a few that were covered in those SIO guidelines, and we'll be looking at a few of the things that can help in some of those common situations. And if we have time, we'll reflect on maybe some of the potential barriers to more widespread adoption of integrative oncology and how maybe we can all be a part of addressing that situation. And we'll obviously leave time for your questions too. Although please do bear in mind, as Sally said, that our panel won't be able to answer any specific clinical questions relating to individual cases. So that's enough from me. I really want to hand over to our panel and maybe start with you, Amit. You've worked as a breast oncologist for many years, and I know you've got many patients who've chosen to use more of an integrative approach. How do you generally respond? Do you ask everyone about this, or do you wait for them to ask, or wait for them to tell you? Yeah, do you actively encourage your patients to engage in any of these self-management approaches? Tell us a bit about how you work in practice with these things.
Yeah, thank you, Catherine, and obviously delighted to be here and share my views, but more importantly, to create this culture of us establishing and acknowledging that it is for the patient's good. And we should also remember that patients are no different to us. Unfortunately, some of us are patients for the future, if not for the current. And it should never appear to us that there is an us and a them. It is, we are all in it together. And if I may share this, I think you have some years ago been with me in my clinic, and you have seen that and as with anybody's experience, there is always an individualization of patient care. One approach is not the right approach for every patient, but it is incumbent on us to be able to make sure that we have offered, discussed, and established the parameters that the patient wants to discuss, the patient wants to sort of look into, and to guide them into it properly. And I think once you establish that confidence with the patient, because the one thing I remember always is that most patients who have said to me about their struggles have said that it is the loss of control, right? And integrative oncology is about giving the individual some semblance of control, what they can do, how they can help themselves, and we are there to make them help themselves. So I think once we establish that level of confidence, then it becomes easier to have the discussions. And we may come at a later stage when, what are the relative contraindications of doing certain things? Because there are times when you have to say, look, we don't know whether this is beneficial or not, perhaps better to be avoided when we are doing the conventional treatment at this time point. But unless the patient's journey has evolved in such a way that there is mutual confidence, you are not going to be able to do that. And you've said that 70% of the times they do not tell their medical teams about what they are taking. And actually, there has been research in US where they found that 30% of the time, breast cancer patients have not been taking their hormone therapy. The GPs might be prescribing it regularly, right, on a monthly basis, but 30% of the time they're not taking it. Now, imagine how detrimental that is to the long-term outcome of the cohort of breast cancer population if we are not even able to get our patients to take things on a regular basis. So I think it's individualized. It is how you establish the confidence, how you discuss the things, and it should be open. And you realize that it's a team effort because you need the support of the clinical nurse specialist because they can also signpost them to the right places. But it's about a team-based approach. And I don't think myself or any individual should vouch and say that they know what is best. But as a team, we should be able to give to the patient what is the most appropriate advice.
Brilliant. I think that's so right. And I think, as you say, the patient is at the center of that team, working with their clinicians. And I think you're so right to say that that trust is what enables people to then come forward and listen to the advice about when might not be a good time to use it and when might be a very supportive time. And I think one of the fascinating things is that the evidence shows that many of these integrative approaches can help people manage things like the side effects of hormone treatments, so actually enable more people to stay on them rather than the worry that, oh, if they go off and do their other things, they'll give up on conventional treatment. Actually, the evidence is that people are better able to tolerate their treatment and can stick with it if their symptoms are being managed in a way that means that their quality of life is sustained. So it feels to me like a win-win situation when we get it right. Can I ask you, you work in many diverse situations. Does your attitude do you find that it's a different conversation that you might have if you're seeing somebody on the NHS or seeing somebody in a private setting? Would that make a difference?
I hope not. Obviously, you have to work with the resources that are available and the facilities that are available. Sometimes it's easier when you know that there is an exercise medicine program that you can tap into very quickly without actually inconveniencing the patient about, try and explore this or speak to X, Y, or Z. So there is a convenience factor, but we do aim to discuss all these aspects with all the patients in whichever sort of, area we see them in. But it's also important to realize that support is multifactorial as well. And sometimes the cohesion of that support is the critical element. There is support in the NHS. It is establishing the cohesion and getting it right so that it seems like a seamless journey rather than going through a few bumps here and there. Not because we want anybody to go through that, but there is always a slight sort of divergence. And that's the important thing, which is why I'm so pleased with what you're trying to establish today and with the attendees that are there, that at least if we can try and bring cohesion, because I'm sure, there are people with different attributes, different expertise, and we all pride ourselves in what we would love to deliver, how we are passionate about that delivery. It's about making sure that that is a cohesive delivery, which gives the patient the best possible patient journey, as we say.
Yeah, I so agree. And it is, from my perspective, so I work for Penny Brohn and I listen to a lot of stories. And when the oncology teams are even just supportive, they don't need to be fully kind of up to speed and experts in any of these approaches, but when they are just not dismissive, even, it makes such a difference to people's experience. So I think that's really helpful. PG, can I come to you? And from a surgical perspective, as a surgeon who will often see people right at the beginning of their cancer experience, how do you approach the subject of integrative approaches? Do you think it's something that could benefit anyone, or are there particular groups of people for whom it's more relevant?
Thank you, Catherine, and for this wonderful webinar and for my invitation. I think we all need to understand one thing, that we're living in a world where stress, sort of some bad habits, whether it's lack of exercise, not having proper nutrition, it is affecting all of us, irrespective of whether we are designated patients or not. As Professor Bell very kindly said, I mean, everybody is a patient at some point in time in their life. And there is a lot of focus about lifestyle modification in vascular diseases or cardiac diseases. I don't see cancer being different. And I think it's time we all take control of our lives and start thinking about how to best manage it, given the situation we are in. And when I see patients in person in my clinic, I always say about the cancer, but at the same time, exercise, a good night's sleep, and food, something your grandma will say. It doesn't take a doctor to tell you that you need to eat well, you sleep well, and make sure you have an hour's worth of exercise in a day. I think we've forgotten those basic concepts in our day-to-day life. And I tell them, everybody, no matter how stoic, how brave you are, this diagnosis is likely to affect your psychological well-being. And you are the best person to actually ring the alarm bell to your team, to whether it's a breast care nurse, an oncologist, a colleague, a radiographer, to say things are not looking well, so that we can signpost you to counseling. Because the word counseling has a negative connotation in today's society for some reason, whereas we all need it at some point in life. And I think that we need to remove that barrier or that negative impact, negative connotation of the word counseling, to say we all need it, we're all going through stress, we all need to identify it and start dealing with earlier than later, when it becomes going down the whirlwind, the spiral, then it becomes more difficult to pull you out of it. So I do have that conversations, and I find that really you are empowering the patient to take control, as has already been said. If there is something which is not looking right and you're not feeling in control, or you're feeling really psychologically down, ask for help. And different people need that different point in the treatment. And so that if you introduce that very beginning, then whosoever they bump into at any point in their treatment, they can then escalate it.
I think that's so helpful to put that there at the beginning, because I think a lot of people feel everybody else is coping and it's just me falling apart. But to have that warning that, you know, this is a big event, it's a life-changing event in anybody's life, and to sort of flag up that it's quite normal to need help at some point along the journey. And I think the words of a patient who I saw have stuck in my head ever since she said it, because I think it rings so true. She said, when I was very first diagnosed, I needed to know, you know, at that time, it was like a rabbit in the headlights. I could hardly take in any information, but I just needed to know 3 things. 1, that I had cancer. 2, that there was something that the hospital were going to do to help manage it. And 3, that there were things that I could do. And just like Amit was saying about that, right from the beginning, feeling that I had some sense of control. And she said, sadly, in my case, I was told the first 2 things. But we ran out of time, we ran out of focus. Like you say, we forget the basics. We're so caught up in some of the technological sort of complexity that we need to explain that sometimes we forget that basic. So I think that's fantastic, PG, that you kind of introduce that right at the beginning and draw attention to the fact that cancer isn't just a physical disease. It has an impact on every aspect of life. So, Tony, I wanted to turn to you because you're a very unusual person as well. You're somebody who has a background in conventional cancer treatment. You were a therapy radiographer, but now you're an acupuncturist employed by Brohn, and you work within the GenesisCare model, which is this very integrated model. Can you tell us why you've chosen to work within this integrative setting, as well as in your own private practice and your clinic?
Yes, thank you, Catherine. Thank you to be invited to this discussion. So yes, the reason why I chose to work within GenesisCare in this integrative setting can be explained a lot because of my background in conventional healthcare. Yes, I was a radiographer and I treated cancer, and the focus was very much on targeting disease and treating that disease, and that was for many years. And it was that the care was there, of course, but the focus was very much on cancer and the disease itself. So with acupuncture, and in this particular setting, we have the opportunity to do so much more. And that was really where I wanted my focus to be, was really to have that wraparound care for the patient, and not for us to be just focusing on the cancer, their disease. So for me, it was being able to deliver a type of treatment that could address the needs of a patient that perhaps cannot be met by conventional treatments, modalities, but can have such an impact on a patient's experience and tolerance to side effects and potentially recovery too. We know that a diagnosis of cancer can bring about significant emotional, physical, psychological and spiritual turmoil. And the treatments too can cause significant side effects And to be able to attend to these needs of a patient within the same coordinated setting makes for a much more valuable and holistic service. Acupuncture itself as a therapy fits in very well within this model of healthcare. To begin with, an acupuncture practitioner will look at the entire patient, not just their disease, but also their things like their body language, their posture, take into account their lifestyle, diet, digestion. Certainly when I see a patient, I will ask them a lot of questions. So already that patient has the opportunity to discuss things that may not have been said before in this particular clinical environment, which of course has a therapeutic value itself. And acupuncture can offer such a range of benefits to patients around anxiety. I think we've spoken about already the psychological and emotional impact that a diagnosis like this can have. And so as a therapy in this setting, it's a tool for patients to use to help them with their side effects, to conventional treatments, and also helping them to navigate their own emotional and psychological situation.
Brilliant. And it really does work so well alongside conventional treatments as well. And I think when Amit was talking earlier about sometimes there might be certain things that you think, well, we're not quite sure about the interactions. In general, one of the things I love about acupuncture is it doesn't involve taking any substances by mouth that might potentially have a sort of a drug to drug effect or a nutrient to drug effect. And so, and obviously it uses sterile single-use needles. So as in it, even when people are quite vulnerable to infection, actually the practice of acupuncture doesn't seem to pose any additional risks, which I think is again something that people sometimes are a bit concerned about. So talking about kind of particular situations where a treatment might be useful, Amit, do you think there are any particular gaps or needs in your patient that you think integrative oncology or integrative cancer care approaches are particularly useful for? Things where maybe the conventional treatment on its own isn't giving a very satisfactory sort of complete solution?
Yes, one of the things that has been a significant advance in the recent years in oncology is the recognition that best supportive care, which is not just about conventional therapy, best supportive care, but actually best supportive care incorporating every element of support, in some clinical trials has performed just as well as third line or fourth line chemotherapy, you see. So that tells us the value of it. And imagine if we could combine that with the advances that are taking place in the conventional treatment pathway, we should be able to harness that benefit. So clearly there is a real unexplored element there, which we are still putting it in a dichotomy, really. We need to be putting it together, basically. And of course, there are studies which have shown that patients who are undergoing chemotherapy cope better with adjuvant chemotherapy in breast cancer when they have got the exercise medicine program. Their fatigue levels are better. Their nausea is better controlled. There are studies in hormone therapy, not just in breast cancer, but in prostate cancer as well, in reduction in hot flushes, giving people less anxiety, like, better mood. So these are significant things. A lot of the important aspect for any clinical team is to make a patient have the appropriate treatment, because we know the appropriate treatment has the best chance of improving their outcomes. But if because of anxiety, fatigue, nausea, the patient is unable to cope with the standard treatment conventional that you were setting for the patient, you're only going to compromise outcome from the standard treatment as well. So why not harness that approach of utilizing the advantages and making it better, both like emotionally, physically for the patient, but for society as a whole, because we want our outcomes to be the best in the world.
Yeah, absolutely. And that combined approach, and as you say, evidence for things as wide ranging as kind of yoga to music therapy to acupuncture to CBT. There are many approaches that can help with some of these very common symptoms, as you've said, particularly things like fatigue, which is very, very common and which we don't really have any conventional good answers for, apart from, as you say, reduce the treatment. Even that doesn't, that might compromise outcomes, but not necessarily help with the underlying symptoms. So thank you. Yeah, I love what you say about the bringing it together in one basket, or not thinking of this dichotomy of either or. And I think that's one of the really frustrating things, when people feel they have to choose either or, when actually, as you say, the two things work so well together and actually help each other work better. So PG, you've talked a bit about the psychological well-being of cancer patients. And I know that's a special interest of yours. Are there any particular, if you see that somebody's struggling, you've mentioned counselling, but are there any other things that you've seen in your experience to help people? And you mentioned exercise as well. Is there anything else that you would consider, or you'd encourage people to consider, particularly to help with some of the psychological things, the anxiety, the depression?
Yeah, I mean, pharmacological treatment is not something I would say is not the first line in my books when it comes to anxiety, particularly which is induced by a particular situation like diagnosis. And I mean, as you said, the other therapies, whether it's yoga or exercises or even sort of meditation, mindfulness. I mean, we in fact we have established a charity in Oxford called Oxford Breast Buddy Group, which focuses on the psychological well-being of patients, not just during treatment, is living with the diagnosis and beyond. And the biggest uptake is that of mindfulness sessions. And I suppose this is true for even everybody in daily life, because this just helps us to focus on we tend to focus on what's missing or what's not there. Whereas focusing on the positives, focusing on what you can do about it, to take control of yourself, to say, no, actually, we can make it better. Let's look at the glass being half full than half empty. I think those are general sort of approaches which just help. Again, how do you read? There are lots of charities, including Penny Brohn, and there are some Head Start apps available now, Headspace apps, which are easily available to download, and you can use them in different circumstances. Again, all these approaches, not every approach is liked by every person. I think it's important that patients are introduced to some of these approaches, and by trial and error, they may find that actually one works better for them than the other. But if it does work, it's far superior to the pharmacological therapy or drug therapy or medications, because you then kind of get stuck to them rather than do something about it and get rid of the anxiety rather than sort of live with it and the medication.
Yeah, absolutely. And I can see that there are a couple of questions popping up in the Q&A. So do keep putting your questions into the Q&A and we will come to these. But in fact, a couple of these questions are very timely, because I'm going to ask Tony what have been some of the main benefits that she's seen using acupuncture. And as she beautifully explained, I think a lot of integrative approaches do see the whole person rather than just focus on the particular part of the part that's maybe not going so well, the cancer or the blood pressure. And we often use at Penny Brohn this metaphor of the soil and the seed, and say that cancer is like the seed, or the seed of a weed that's growing somewhere. But actually, and the cancer doctors are fantastic at different techniques to remove the seed with wonderful surgical techniques, or poison the seed with chemotherapy, like weed killer, or use things like radiotherapy to maybe burn the seed. But they don't pay much attention to the soil that the seed is growing in. And that's where this holistic integrative approach comes in. And so I think one of the questions is about long-term pain after a wide local excision, and thinking about pain, and if the pain is kind of influencing that, if you're in pain, your ability to live a good quality life is severely compromised, and then maybe your ability to do other things that might help, like take exercise or like sleep well, may be affected too. So, and there's another question about specifically about inflammatory breast cancer, and I think it's interesting because, again, the inflammatory breast cancer is growing somewhere. So an integrative approach might be more focused around what can we do for the soil or the terrain, sometimes we call it, or in fact, basic science now calls it the microenvironment of the cancer, because we know that the environment where a cancer grows is very important, determining whether that cancer is going to grow quickly or slowly, or regress or advance. And so attending to that microenvironment, whatever the different type of cancer is, can be very beneficial. So Tony, tell us a little bit about the things that you've seen, the real benefits that you've seen, and maybe think about pain, and maybe think if you've got any particular tips around or experience around seeing people with inflammatory breast cancer, that would be helpful too.
Sure. Okay. So yes, I mean, I've seen a number of patients within the GenesisCare setting, and most of the patients I see, there are obviously undergoing cancer treatments. And so I see many of their concerns, which are related mostly, although not always exclusively, to side effects from treatment. So we know that acupuncture can be very useful treatment for some of these side effects. So things like hot flushes and night sweats are perhaps one of the most common side effects from treatment that I will see. And also things like fatigue, nausea and digestive problems as well. And of course, just going back to the night sweats, obviously this can cause a bit of a lack of sleep. And I think talking about the multi-terrain as well, and something simple as lack of sleep can have a huge influence on us. Anyone who's had a terrible night's sleep knows the impact it has on our next day activities. And so therefore trying to help with treatment to try and help with something simple like sleep, so that there isn't chronic insomnia, really does help ensure that that terrain that we're talking about is conducive, or certainly not causing any unrest or inflaming a situation that is already there. And those daily activities that we talk about as well, I think it's worth saying that trying to treat patients to ensure that those simple daily activities they can still do gives them some sort of normality and familiarity in their life. So it's important to ensure that they can still do them. And so treatment to help ensure that patients can still undertake those normal daily activities that they're used to is really, really important. I think other side effects from treatment that I will see most commonly, things like digestive problems as well. And of course, chronic pain too. I think we've just heard, certainly NICE have just in their report have indicated how acupuncture, as well as psychological therapies and exercise therapies as well, have shown to be really valuable in chronic pain. And so I think being able to manage someone's chronic pain, or helping them to manage chronic pain as well, doesn't exacerbate other problems and other issues that are going on for them.
And I think what's lovely is with the integrative toolkit, you can use more than one approach. So sometimes it can be that acupuncture just helps you need less of your painkillers, or sleep better so that you can exercise a little bit more, so that helps the pain. And I think, PG mentioned the mindfulness, which has got a very good evidence base around this, but certainly we now understand how acupuncture, even the mechanism of acupuncture in pain, and as you know, NICE is the National Institute of Clinical Excellence, which determines the protocols that NHS doctors can use. And acupuncture has been approved, as you say, for pain because the evidence is so strong that it can really help. And again, it's not for everybody, but it's certainly something that I would say is worth a try. Another thing, if people have got really chronic pain that has recently become available, and I think will be a very powerful tool to help with people and reduce maybe the amount of opiate-based, so that's kind of things like codeine and morphine-based painkillers, is medical cannabis. And I think a lot of people think, oh my goodness, that's quite sort of, you know, way out there, isn't it? But actually, in the last couple of years, this is now a licensed medication that doctors can prescribe in very sort of you know, controlled circumstances. It needs to be a specialist doctor who can do it. But again, for chronic pain that's not well controlled by other modalities, I've certainly seen some extremely good benefits. And I think, sadly, I think there have been 3 prescriptions for medical cannabis, even though it's completely legal for an appropriately trained doctor to prescribe it on the NHS, but there's a lot more available in the public sector. So that may sound controversial, but actually the evidence base is, again, huge for that in pain and in many of the symptoms related to cancer. So it is something that I think we'll see more of. There's a question in the panel, in the Q&A around prevention, and I think prevention is something that I think an integrative approach can really, really help with, because what we're trying to do is build your resilience. And we all know that every single person who's alive today will have probably at least 1 million cancer cells circulating in their body at any one time, because that's a normal process of the way our cells multiply and divide. And some people are obviously at more risk of creating more cancer cells, but our bodies are constantly producing these cells, and constantly our immune systems are recognizing them, dealing with them, getting them out of the way. And depending on how our overall state of health is, and I think, you know, obviously things like general nutrition and physical activity and all of those sorts of things do contribute to that, but anything that we can do that builds our resilience is really helpful in terms of preventing cancer. And we talked a lot, and PG mentioned some of the lifestyle habits that just living in 21st century Britain or in the Western world today, it provides conditions which are probably not the right conditions for us all to thrive and be as healthy as we can in. And so we actually have to work very actively to prevent things. So I really wanted to kind of now come to some of the situations where maybe it isn't so appropriate to use an integrative approach, and maybe some of the downsides. And I think maybe to Amit and then maybe PG, any times you've seen people run into problems when they've tried to use an integrative approach, or anything that you'd be cautious about? Amit?
Yes, thank you. I think it is important to sort of discuss with the patient that there are lack of evidence doesn't mean lack of benefit, but lack of evidence also doesn't mean lack of harm, right? And that is important because, for example, we have done in our center, we have done preclinical studies looking at radiotherapy, killing how many cancer cells in a Petri dish. And then you put like sort of green tea and try and protect the cancer cell from the antioxidant damage from the radiotherapy, and you see a slightly lesser cell kill. Now, does that mean that green tea is bad for you? We don't know that. Nobody's done that experiment in human beings. But we know that the effect of antioxidant from green tea is likely to last for a few hours. So if a patient of mine is wanting to have green tea, I would say that's fine, but can you make sure that you're not having it within 6 hours of radiotherapy? So there is a little bit of having a discussion with the patient to explain that it's difficult to do such studies. How can you do a study where you will expose some to a problem and to a change and some not to a change? Because this is multifactorial. There are other elements like, how does stress, we know that stress is incriminated in many medical conditions. But can you show me a study where stress has been randomized? You cannot, right? So how do you randomize stress in a clinical trial. We all talk about level 1 evidence of a phase 3 clinical trial. Can you put ladies or breast cancer patients into no stress, mild stress, moderate stress, extreme stress? So you cannot. So there has to be some level of acceptance, some level of practicality, but more importantly, some level of trust and confidence and doing the right thing, you see. Things like high dose vitamin C, which, come in the conversation sometimes. Now, again, there are studies with that which have shown detrimental effect as well. And there are studies which have shown beneficial effect. But when you are giving conventional therapy and you don't know what the interference might be, then it is actually more prudent to say, look, let's not do this. But there are other things that can be done, like Tony can give you advice on acupuncture. You can have mindfulness, you can do yoga, you can do relaxation exercises. So, let us not think about integrative oncology or integrative care as being a one tool pony. It is there are so many things that can be done, and it's that sense of helplessness that we don't want, where you find someone thinking, oh, if only I could clutch onto this, I'll be fine. Well, if that's not the right thing in your perception, then at least give them something else that they can think about.
Yes, I think that's absolutely right. And I often talk about this kind of many pieces of the jigsaw, and how actually it's not just one piece of the jigsaw that makes the whole thing, but there are many different ways, and some might be most appropriate at one stage and some might be appropriate at another stage. So I think that's really that's a great reminder. And sometimes the simple things are the most powerful as well. And I think that's something that we generally, in our modern day technological thing, we have great faith in technology to solve our problems. But actually, simple things like breathing, and as PG said, an hour of, or it's even half an hour to 20 minutes 5 times a week of some moderately strenuous activity can be as powerful medicine as any of these, more fancy things that you might have to pay an awful lot of money for and travel. So I think I'm aware of time, and that there are some some of the questions. I hope we've answered the questions that have been dismissed, so that's good. We talked a little bit about chronic pain, and whether it's after radiotherapy or whether it's after surgery or whether it's as a result of the actual cancer itself causing pain. I think one of the lovely things that integrative oncology approaches offer is this multidisciplinary approach to pain. And I think many pain clinics will use an integrative approach. There's acupuncture in many pain clinics. A lot of them do teach mindfulness practices. So I think being referred to a pain clinic if you've got chronic pain makes a lot of sense, but also there is a wider toolbox that often can be found even beyond what is standard in a pain clinic. So because they usually those 2 approaches, psychological approaches and then pain medication, and if you're lucky some acupuncture, are the standard offer in many pain clinics. But there are other broader things, as Amit's mentioned, and love and support and feeling in control and not feeling helpless with pain and can make a big difference. And as Tony said, I think really focusing on can we improve sleep, because we know that when people sleep better, their pain perception is also better. So let's think then about if there are any other final thoughts that we want to leave the audience with, and sort of think about things. I mean, I suppose there's lots to talk about. I think, Tony, from your perspective, we know that a lot of practitioners have suffered during COVID, and a lot of people who want to access some of the complementary therapies that might be included in an integrative approach have it's been difficult. Any tips about how people can access, if they are interested in exploring some of these things, how you'd go about it if you're not lucky enough to be in a GenesisCare centre?
Yes, yeah, sure, absolutely. So I think the first distinction to make is to be really clear about is the difference between complementary and alternative. So I feel quite strongly about the treatment that I do is a complement to conventional healthcare, where I am in GenesisCare. And I'm a practitioner. I'm not treating cancer. I'm not using it as an alternative. I'm treating the patient. So I think that's really important to be clear that it is a complementary therapy that patients should look to have, as opposed to alternative. But certainly during the COVID situation, when there was full lockdown, a lot of practitioners were not able to practice, but currently now they've been lifted. So it's always worth, certainly from an acupuncture perspective, and I know that there are a few different governing bodies for different complementary therapy modalities, but certainly for acupuncture, there is a regulatory body, which is the British Acupuncture Council. And this is itself regulated by the Professional Standards Agency. And in order to be a member of the British Acupuncture Council, a member will have had a degree level training, which is important, and also have done training in Western medical sciences, so including anatomy, physiology, pathology, which means that there's a baseline of education that each practitioner in the British Acupuncture Council will have. And they will also adhere to a number of guidelines and protocols in terms of treatments and professional conduct. So it's anybody wanting to access acupuncture can go onto the British Acupuncture Council website and look for practitioners in their area. And because of that, the practitioners currently will be undertaking the guidelines from the government and also from the council in terms of face-to-face practice. They'll have screening, COVID screening in place, full PPE, cleaning, schedules, just really to protect all of their patients, and of course themselves as well. And the main thing is, I think, is also to have an open dialogue with the practitioner, with the acupuncture practitioner, and also Western medics as well, and to ensure that that's good. That is an open dialogue between all sorts of practitioners, making sure the patient is always at the centre.
Yeah, and just, I think exactly as you've mentioned for acupuncture, most of the other types of complementary therapy will also have their professional bodies which require them to be trained and registered and insured. And so I think it does make sense, if you're looking for somebody to go to a registering, to make sure they are a member of a professional body, and to ideally ask if they've got experience working with people with cancer, because I think it can be a bit more complicated. Sometimes people are worried about about going to see a complementary practitioner if they have got cancer, and sometimes practitioners don't feel confident. So using somebody who is confident and experienced can be very useful. And I think, like Tony, I would definitely say, make sure you see somebody who sees themselves as a complementary therapist rather than as an alternative therapist, unless, that's what we call this integrative approach, is prepared to work alongside your conventional team, because that feels really important. So there's one question about, and I think this is a good one for you, PG. What advice can you give for somebody about self-monitoring for signs of secondary disease, and what options are available to extend a good quality of life? And I think we know that when people finish treatment for cancer, there's often this anxiety about, how do I know if it's going to come back, and what can I do? And that post-treatment sort of anxiety, and scanxiety, sometimes people call it, when you're due for a follow-up. Any tips for good quality of life after cancer treatments?
I think there's quite a few questions wrapped in one question.
So not much time, so it's going to have to be your distilled. Yeah,
so I think just untangle it. I think mindfulness is the way forward for most of the people who finish, because it's often when you finish treatment that people go off the cliff, because you're very well supported by a massive team, medical team, and you feel kind of there is somebody to take care. And the degree of dependency as a human tendency comes in, and then suddenly the treatment is finished and everybody's like, take a deep breath and like, oh, it's all done, there you go. And you kind of feel, what now? What do I do? So I think that's where, and therefore it's very important that we start making patients taking control of their lives from the earlier on, rather than just when the treatment is finishing. And that's where they start sort of practicing some therapies whilst they're having treatment, so they don't feel they're left by themselves at the end of the treatment. And having that, and the second is very important, is a prognostic dialogue with your clinician is very, very important, because a lot of times I understand that people do not want to know very early on at some point, but it's important to have that dialogue, particularly if it's going to raise anxieties, to have the open dialogue. What's my risk? We're very fortunate with the screening programs, early detection, that majority of our women have gotten excellent outcomes, very good outcomes. So they can be sort of sometimes, even with the DCIS patient, which is a precancerous change, it's a curative treatment we offer, but the psychological downside of that is massive. And that's where it's very important that patients understand their individual prognosis. And the third is obviously monitoring. And not everybody needs whole body monitoring. And that's the key to understand. And it's not because NHS cannot afford it or people can't pay for these scans. There are several studies have shown that by scanning regularly, you do not pick up problems, and there may be false reassurances to people, because you may have a scan fine and 3 months time there's a problem. Just because you had a scan, you may not represent to the doctor after 3 months, and you wait for the next scan for another 9 months. So if there is a problem which is persisting, whether it's a headache or a pain in the back, and it's not like you have a headache for 2 hours, you take your GP and ask for, have I got brain metastasis? Whilst that thought would cross people's mind, but if there's something genuinely which is persisting for a while and it's not getting better, then of course, like anybody else, you must go and get seen if there is a concern. And people will be having a low threshold to investigate you if there is a need for investigations, and you need to trust your medical team to make that decision to do that. Yeah, I think that's kind of, and just getting back your life after treatment so that you can get back to doing things you love. I think that's the key, to immerse yourself in things you like.
Yeah, and to remember how important
working, watching Netflix, whatever it is.
Absolutely. And right, that comes back to what Amit was saying at the beginning, is feeling in control means that, you know, your life carries on alongside the cancer. And it's so easy for cancer to take over, and then you to feel a little bit lost about, how do I pick up my life again? How do I get back into the driving seat? So we've got time for just one quick thought from each of you. I just wanted to ask Amit, you know, if you developed cancer, do you think you would use an integrative approach yourself? And in a couple of words, what would you be looking for if you did?
My simple answer is yes, most definitely. I've seen the benefit my patients have had from this approach, and I've seen it in some who were reluctant to consider this approach, but when they came back, they confirmed, or they said that they were like, sort of, you know, how much they benefited from it. So certainly I would use it. And I think the important aspect is to remember that we all talk about life-changing events, but we do not actually understand what it means till we go through that. You know, we might feel we are very empathetic, we have read about it, we've talked about it, we've done courses. A life-changing event is a life-changing event. And unless you've been through it, it's very difficult to understand that. And it is only from seeing what the patients you have had the privilege of treating, you learn from that.
Thank you. Tony, just a quick one to you. What's the one change that you'd like to see in the way that integrative oncology is provided in the UK?
I think provision more widely spread and becoming more mainstream for holistic care. Perhaps not relying on practitioners to be volunteers.
Thank you. And PG, just one final tip for anyone in the audience who's wondering if an integrative approach might help them after their diagnosis of breast cancer. What would you say?
I would say take control of your life.
Yeah. And it's one size fits all. And I think we've all said this, that there are many things, there's many different pieces of the jigsaw. They may not all be appropriate for you at any particular time. It may change over time. And just because it works for your friend, your aunt, somebody else, it may not work for you. So I would, my little final tip is try these things in a safe way, and tell your team about what you're planning to do, and get advice along the way and support, and do ask for support, because self-management it's great, but you can't always do it all on your own. And I think support it's really important to do that. And I think one of the things that I sometimes see is people trying to take, one of the few downsides of this integrative approach is that people often then feel, okay, well, it's all up to me, and the responsibility for whether my cancer comes back or not is down to whether I meditate enough hours in the day, eat enough, broccoli, or exercise enough. And I think it's really important to be kind to yourself and realize that it's not all under our control. There are things that we can influence by taking some control, but none of us as humans can control everything. So I think it's about doing what you can with what you can. And as everybody on the panel has said today, enjoying it, making sure that the things that you're doing actually make you feel better and feel more resilient. And I think that on that note, hopefully we'll leave you inspired to sort of find out a little bit more about integrative oncology. If there are any health professionals in the audience, or if anybody in the audience is minded to tell their health professionals, we're doing a whole day for professionals looking after people with cancer on May the 15th at a conference called Integrative Oncology UK 2021. And tickets, the early bird still goes until the 1st of May. So do get on. I'll type I'll put the website into the chat, can I do it into the Q&A? I'll put it into the chat if you can see that, just in case people are interested. The more people are talking about this, the better. And the point is to just bring together those professionals to learn from each other in an inspiring and sort of interested and curious way, because we can all learn from each other, as I hope you feel from the panel tonight. So Sally, I don't know whether you want to take over and say a few final words.
Yes, thank you so much. Sorry we've run a little bit over time, but it seems to go so quickly. I hope it's been really helpful, and we just wanted to launch a really quick poll so that we can understand, has this webinar helped? What can we do to make it even better? So it's just being launched for you now. So if you could just go through, I think there's not too many questions to answer, but it would just be so grateful. So I'll just let that go on. This is where it's interesting because I don't know when it's going to end. So hopefully, Nina, you'll let us know when the poll's finished. So it shouldn't be long.
And while people are filling in the poll, I would just really like to thank again the members of the panel on behalf of Penny Brohn and GenesisCare. It's been superb, and really thanks for your open-mindedness, for your reflections, for your skills and your experience that you've shared with us tonight. It's really fascinating, and I think I hope people are taking away the fact and the knowledge that there are things that they can do alongside their treatment that can safely make a difference and support them.
Thank you. So we'll just continue to let people to answer the poll. I've put up the some information about our charity as well, Penny Brohn Charity. So just want to thank you all. Thank you for doing the polling questions. I think we're almost through.
And just reminding people that if you don't know about Penny Brohn as a charity, there are an awful lot of the services that we've talked about tonight available without offered on a donation-only basis, available online. So if you are wanting to find an exercise class, or wanting to learn how to meditate, or wanting to learn about how you can eat more healthily in a way that supports your health, or wanting to understand how to get the best care alongside your treatment, there are many sessions that people can access. And so do look at our website and contact us to find out more.
Thank you. I think there's maybe one more question to go. So I'll just wrap up by saying that we're doing these webinars. It's always the last Thursday of the month. So our next one is on May the 27th at 7:30 in the evening. We haven't quite confirmed our guest speaker, so we're hoping to get somebody in particular. But all the channels where you heard about this webinar today, you'll be able to pick up for next time. As Catherine said, please do visit our website or GenesisCare UK's website for more information. And if you are in a position where you feel that this webinar has helped you and you can donate, then obviously we are a charity. We don't receive any funding from the government. So if you're in a position to do so, please do give what you think this webinar was worth. And we just thank you so much for joining us this evening. Still, polling is still going on. This is the very last question. I know this is the last question. So thank you so much for your input today. So we'll just wait for everybody to poll, and then when you're ready, wish you a really lovely rest of your evening. Thank you so much.
Thank you for joining us.